Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on signs and symptoms. There are no other symptoms, only symptom is they can be patches which are grey or which are brown or sometimes greyish brown in color. They are seen on forehead, they are seen on nose, they are seen on cheeks, they are seen on chin and also above the upper lip. These are the most common sites for this disease. And coming to the investigations, there are no special investigations required for this. Just by observing we can say that this is melasma. Sometimes you may need investigations because there are a lot of reasons for this: hormonal imbalances, metabolic disorders. We will be looking deep into them to rule out those diseases. Sometimes we may need to do some investigation. Before going deep into this disease, you have to understand some basics of anatomy and physiology so that you can appreciate the importance of this disease. Coming to the anatomy means normal structure of your skin. There are three layers in your skin. The topmost layer is epidermis, middle layer is dermis, and bottommost layer is hypodermis. Coming to the epidermis, this is the topmost layer, and this again has some different layers. The bottommost layer of this epidermis is known as strata basalis or the basal layer. This layer contains a special type of cells, we call them as melanocytes. Melanocytes are very important for our future discussion. Coming to the physiology, normal functioning of the skin. So what happens here is these melanocytes produce a pigment that is known as melanin. Melanin is a black color pigment. Once these cells produce this pigment is going to be diffused into upper layers of the skin. For example, there are several layers on the epidermis. On the bottom layer, the melanocytes will produce dark pigment. They will be piling up of cells. There are a lot of cells above this layer also. These cells slowly take up this melanin and get the characteristic pigment. The people who are fair have low melanin synthesis, and the people who are dark has high melanin synthesis by these cells, and the uptake of this melanin pigment is also high so that they look darker in color.
Fidicus Homeopathy.